Hello, my name is Eve, and today we'll be talking about seizures. Okay, seizures occur when abnormal electrical signals in the brain fire rapidly from neurons. Okay, it can either be generalized or focal, meaning a specific part of the brain is affected to which a certain limb is moving versus the whole body. That's what partial or focal. Okay, neurons, they handle and transmit information from electric signals. Okay, you have two types of neurons, two types of neutron. You have two types of neurons. Okay, you have your excitatory neurons, which release glutamate. Glutamate is what makes your muscles move. Your inhibitory neurons, they fire or release GABA, and GABA is going to relax the muscle. Okay, in seizures, there's something going on with your inhibitory neurons. They're not stopping the signals from making your muscles move. So there's constant signaling to your muscles to move. Understand, these signals are electric impulses, electricity, and they're stimulating your muscles to move. If you're constantly being stimulated, it's as if your brain is shocking your muscles and you have no control over it. It's going to move. This is where you're going to get the jerking and, well, the stiffening of the muscles. When it constantly is being triggered by electricity to move, it's going to become stiff. Now your muscles, it can't remain in that action state. It's going to need to rest, even though it's not the comfortable way the muscles rest. It's getting some form of rest. So that's where you get the jerking that comes with seizures. Normally there's an equal balance between the excitatory and inhibitory neurons, to where if a muscle move, it relaxes. But in seizures, it's constant triggering of that muscle. Some medications that help with this are your barbiturates, your valproic acids. We'll talk about the medicines when we get there, okay? Causes of seizures, it can affect anyone. So just know that illnesses like meningitis, especially like central nervous system illnesses, if you had a stroke, hypoglycemia, fever, alcohol withdrawal, acid-base imbalances, hypoxia, not having enough oxygen will cause seizures, and brain tumors. Okay. Some patients have epilepsy as frequent seizure activity due to chronic conditions. Okay, like a traumatic brain injury, congenital, like you're born with it. If you had a stroke, it can happen just because it's idiopathic. We already said illnesses. So let's talk about the stages of a seizure for when it occurs. So the prodromal phase is where symptoms start to appear prior to the big event. And these happen like days before the actual seizure happens. If you have a patient who says, well, before I get my seizures, I smell something, I smell a funny smell, or I taste a funny taste in my mouth, or I see visual changes days before I have a seizure, that can help you prepare that patient for that seizure, so that they won't lose their, they won't die. Okay, because seizuring like that, it affects your breathing. Your lungs are a muscle, and it's constantly being stimulated by your nerves. Is not able to expand like it's supposed to. It's constantly being triggered. Okay, so we want to We want to know those signs so that we can have our oxygen ready, have our rapid response team ready just in case they go into status epilepticus, and we will talk about that. Okay. So some things that they may experience during this prodromal phase, days before the actual seizure happens, like some depression, there'll be some anger, lash outs, all right, issues with sleeping, some anxiety, GI and urinary issues, may have some incontinence or things like that. All right. Now, that's the first stage. The second stage is the Aurora phase, and this is where these certain signs and symptoms happen seconds to minutes before the actual seizure. So in prodromal, it's days. The Aurora phase, it's seconds to minutes. And they might say, they might have altered vision or hearing issues, or they have some anxiety right there. They might say they have deja vu. They might be dizzy, a sudden weird taste or smell, an inability to speak. Okay, so I know I said though I don't want to get y'all messed up. So the depression, anger issues, sleep, and anxiety, those are symptoms that happen days before the actual seizure. The short phase, the Aurora phase, you will have these: the deja vu, dizziness, sudden weird taste or smell, inability to speak, altered vision or hearing. Okay, when you locate or detect these early signs, you want to go ahead and put them in the side laying position so that they won't hurt themselves, because when a patient has a seizure, especially when it's generalized, they're going to lose consciousness. They're not going to be aware of it happening. So they're going to fall just where it can hit their head, bust their head. So these short signs and symptoms will help you be able, okay, let's go ahead and put them on a side. Get the pillow. Don't put nothing in their mouth. You want to time the seizure. How long, what were they doing before the seizure happened? How long was the seizure? Because a normal seizure is supposed to happen between 1 to 3 minutes. If it's over 5 minutes, which you shouldn't be waiting that long anyway, because me, after that third minute, I want to be able to have someone call 911 after 3 minutes, and I know I ain't waiting 5. I'm just saying. If it's more than 5 minutes, they have gone into status epilepticus, and this is where the body cannot stop itself from seizuring. You're going to need medicines to be able to stop it from seizuring, and that's why you want to make sure, if you know they're a seizure candidate, they have an IV access site that is patent and it's working, so that if they get into these seizure episodes, it's easy for us to administer your barbiturates or lorazepams to help calm them down. The third stage of a seizure is the ictus, and this is where the seizure is actually happening. And it, like I said, lasts 1 to 3 minutes. You want to time the seizure. We already talked about if it's greater than 5 minutes, we're going to call a rapid response. We're going to get some IV medicines in them, okay? So again, the first stage is the prodromal. Symptoms start days before the seizure. Then the second phase is the Aurora, where seconds to minutes they're having symptoms. Then the third phase, they're actually having the seizure. The fourth phase is ictus, is post-ictus. This is after the seizure. They're going to deal with the recovery period. This is where they're going to be healing from that seizure. Understand, their whole body has been shocked by the brain. So their muscles are going to be sore. They're going to be sore. They're going to need some rest. They're going to be tired. Yeah, this does hurt them, y'all. This recovery phase can take hours to days, especially in tonic-clonic, your generalized seizures, your grand mal seizures. or the recovery can be immediate, like the in your absence seizures, where they're not having any symptoms. They can be drawing, and in the midst of drawing, they stop drawing, and they having a seizure. It looked like they daydreaming, and then after the seizure is done, they go back to what they're doing. They have an immediate recovery. Some seizure candidate patients, their recovery is not immediate like that. They're going to need rest. Like I said, so during their recovery phase, they're going to be very tired. They want to sleep. They're going to be confused. Some of them are not going to remember that they even had a seizure or even know that they had one. They may have a headache, and they might have injury. They might have bit their tongue. They might have hit their head on something. They might have bit their cheek. Our job is to keep them safe until they come back, get back with it. We don't want them to hit their head, so they probably want to be able to catch them and lay them down gently, okay, to protect that brain. Because the injury to the brain, too, can cause a seizure, too. So now we talk about the types of seizures. You can have a generalized where the whole body is affected, or you can have partial or focal where a specific limb or part of the brain is affected to where only a limb is affected. So when we talk about the tonic-clonic, which is a generalized seizure, they're going to have the stiffness, which is the tonic portion. That's what tonic means. And the clonic is the jerk. We already talked about the tonic and clonic. Okay. In clonic, with the jerking, it can be symmetrical or asymmetrical, meaning that if it's symmetrical, the whole body is jerking. If it's asymmetrical, one part of the body is jerking. Okay. You can have absence. We already talked about absence seizures. You can have atonic, where you drop attack, and you want these patients who are candidates for this one, who have this type of seizuring, they need to wear a helmet pretty much at all times, because they don't know when their seizures are going to happen. Because when these happen, they're going to fall automatically. Okay, they're going to hit their head, so they need to have a helmet on. Immediately after these seizures, they regain their consciousness, but during they're not aware. They're not aware of their surroundings, so that's why they need our help, nursing help. Another type is your focal onset aware, or your simple partial. Symptoms vary, location is dependent, so they can have a seizure in their arm and it just be flapping and moving. Okay. These can be an aura for a even bigger seizure. So if one person just have one for 2 minutes, they're 2 minutes. These focal onset aware seizures, or your simple partials, 1 minute they'll have one limb or whatever jerking, and then shortly after they will have the focal impaired aware, the complex partial. Okay, so they will go to the seizure where they become unaware. So at first it was just they're aware that they limb, they're conscious, and then that's the aura for when they're going to have the seizure where they're becoming they're not going to be conscious of what's going on when they're having a seizure. It's going to be a seizure and they're not going to be aware of what's going on. It usually affects the temporal or frontal lobe of the brain. So these the complex partial is the temporal. Okay. Okay. We want to make sure they have seizure precautions, oxygen and suction at the bedside, IV access, padded bed rails, the bed at the lowest position, have a pillow so they can have their head on, no restrictive clothing. Okay. How long do the aortas last before the seizure gets there? When you're documenting about a patient that's having a seizure, you want to document these things so to help for early detection in the future. What type of seizures do they have? Is it just one limb? Is it all the whole body? Are they having tonic and clonic symptoms? Is it stiffening and jerking? Are they foaming at the mouth? Did they hit their head? How long did it take? Want to put them on their side so that fluids can drain out and they don't block their airway with their tongue. Do not restrain. Don't put nothing in their mouth. Remove restrictive clothes. Time the seizure. Note the characteristics. Be calm and reassure the patient. Types of seizures. Retain. After the seizure, you want to check their vital signs and do a neuro assessment. How are they behaving? Are they behaving different from what they usually behave because they just had a seizure? That can affect your LOC. It can do some damage. It can. Could they hit their head too? Drawing blood to look at the drug levels, because if they've been taking their seizure medication, then they had a seizure, their levels might be too low. So those blood draws will help you detect that. Check their medication levels. Ventolin, we'll talk about that when we get to the medicines. EEG, where they put brain cords on the brain to visualize seizure activity. Before they go to this procedure, let them know that it's painless. No coffee before the test. Hold seizure medications so they can that's what they're going to see about their seizure. We don't want the medication, they won't allow it to show up. They can eat before the procedure. You want to wash their hair. You want to check to see if they can go to sleep prior to the test or not. Check their breathing and lighting. We don't, because some lights can cause a seizure. Know their triggers. If it's stress, trauma, overexertion, if they're on their cycle, they're pregnant, sleep loss, electrolyte imbalances, metabolic issues, illnesses, visualization disturbances, sounds or smells. If you smell a certain thing, it can trigger a seizure. If you're arguing, it'll trigger it. Know the triggers. If they're under medicated, check those blood levels and drug levels. All right. Recreational drugs, they can do it. Alcohol, that can do it. Let's talk about the medicines. Barbiturates, phenobarbiturals. They're used for your tonic, clonic, your generalized and focal seizures too, and during status epilepticus. It stimulates the GABA receptors, and this helps inhibitory neurotransmitters work better. The side effects, it causes drowsiness. You don't want them driving or nothing like that, so that's why you want to tell them the side effects. It can lose ataxia, cause them to be a little dizzy and things like that. The coordination will be off. So, no driving or nothing like that. It can cause respiratory depression. Understand that GABA is your inhibitor. It's going to relax the muscles. So if they're taking a medicine that's going to relax their muscles, like your lung is a muscle, you want to watch for respiratory depression as well as hypotension, because if you're in your rest state, your blood pressure is low. All right. The drug level for your barbiturates is 15 to 40. So if you do a blood draw after your patient had a seizure and they said their levels is at 10, you could see that they're not getting the high enough dose to prevent seizures. Okay, now we're going to talk about phentonin, used for your grand mild seizures, your tonic-clonic, okay, or focal seizures. You want to monitor their gums here because they can have hyperplasia where your gums are enlarged or they're like shrinking. It look like they're enlarged because of the shrinkage, and they'll be bleeding, okay? Bone marrow suppression, so watch for platelets and white blood cells. There's a risk for infection here because this drug, it decreases those numbers. It affects the bone marrow into which these cells, your immune cells, are come from, okay? Monitor for rash. Don't give with milk or antacids, and the drug level for phentonin is 10 to 20. So you draw some blood and the levels for their phentonin is saying 7. This lets you know that they're not getting a high enough a dose of their drug, their medicines, to stop the seizures, prevent. So now we have benzodiazepams. That's another medication used for absent seizures and generalized seizures, your tonic-clonic and focal. All right, diazepam, lorazepam. They're fast-acting for status epilepticus. Side effects: they become very drowsy, and it impairs the liver. Yeah, but you would take that versus being shocked all day. I'm just saying, just let them know that, and know that the body can become tolerant of the benzodiazepams, meaning that it won't work in the future. Depending on how long they've been on it, it can wear off to where it won't work at all. So let them know that. The reversal agent for your benzodiazepines is flumazole. Okay, because it's going to cause them to be real relaxed, and if they're too relaxed, we need a drug that's going to reverse that effect. Another drug is your valproic acid. It's used for all types of seizures. We want to monitor liver function, white blood cell count, and platelets, and GI issues. Other treatment: surgery to remove that area of the brain that's been affected. You can have vagus nerve stimulation, where they're going to stimulate that vagus nerve to decrease. It's like a way of decreasing nerve impulse stimulation, nerve stimulation. Okay. And then there's a ketogenic diet that's used for the pediatric patients, where it's high fats and low carbs. High fats and low carbs. All right. We covered seizures. All right, thanks.